Hello, my name's a brief presentation giving a personal perspective of my own career development to date, and also some information about national recruitment and the picture with careers nationally that you will face over the coming 12 months. So I am a consultant anaesthetist. I work in Brighton and Sussex University Hospitals, where I'm also the lead for neuroanaesthesia. Since 2016, I've been an Associate Postgraduate Dean working for Health Education England in KSS. I'm the County Dean for Sussex and have worked very closely with your trust since then. I'm also a Royal College of Anaesthetists Council member, and I chair the Education, Training and Examinations Board, and I'm a senior lecturer at Brighton and Sussex Medical School. Now, over the course of my career, I've developed a very keen interest in medical education, and this is in no small part due to my own very positive experience of education and training, both as an undergraduate and a postgraduate doctor. And I'm extremely grateful to many of the people that were responsible for that training. And I think when you look back at where I was when I started my career at medical school, the transformation will be more apparent. It's fair to say that this is taken in 1990, when hairstyles were very different to how they are these days, I would like to think. And I was something of a rough diamond. And over the course of my 5 years at medical school and subsequent postgraduate training, I have changed significantly into the person that I am today. And this is really very much down to the people that gave me their time and attention and consideration as trainers. And this gives an indication of where I am at the moment. This is me a few years ago signing the college register when I was elected to council. Unfortunately, I've had to lose the beard this year, but it just goes to show that any transformation is possible in medicine. So before I start about my own personal journey, I just wanted to say a few things about choosing a career. I think what's really important to bear in mind is that the good news is that there are plenty of jobs out there. There are jobs for everyone. So there's absolutely no chance of anybody not being able to access something to do in a career in medicine. However, having said that, some careers, some specialties are very competitive. That's always been the case and probably always will be. However, you can apply for more than one thing. You can apply for specialties, and therefore you can try and maximize your opportunities of being successful in interviews. I think before you do that, you need to think about yourself first of all. You need to think about what you like and dislike in medicine, your own personal strengths and weaknesses, be it academic skills or practical skills, and then think about your longer term aims as well, because it's important to remember that your time in training is only a small proportion of your medical career in all. So going back to me, this is me a few years later in my 4th year at medical school, and this is where I had my first introduction to anaesthesia. And I was lucky to be allocated to work with a cardiac anaesthetist for a couple of weeks, who was an absolutely lovely chap who looked after me in theatre. And I was able to go and witness cardiac surgery for the first time, which was very exciting, and cardiac anaesthesia, which is very technical and exciting as well. One of the important fundamental principles of cardiac anaesthesia is that when your patient is going on to bypass, they need to be anticoagulated. So it's important to give them a large dose of heparin quite early on in the operation. Now, task on one occasion of going to draw up the heparin that we were going to administer to the patient. Unfortunately, in my naivety, I had no idea what the black dot on the ampule meant, and this is the direction that you're supposed to snap off the top of the ampule. So unfortunately, I wrenched the ampule in front of me apart, not aligned to the black dot, and it shattered in my hands, causing multiple lacerations to my hands and fingers, which of course were all contaminated with neat heparin, which therefore caused me to bleed profusely for a very long time indeed. And my poor consultant, trying to stifle his laughter, was kind enough to wrap my hands up in bandages and suggested that I elevated them above my head for the rest of the case. He also suggested that I might want to draw up the protamine as well in the same way, so that I could reverse the effect of the heparin that had caused the bleeding in the first place. Having said that, I quickly established my love of anaesthetic practice and chose it for my own career. And I've never looked back since, really. So I started in 1997 and I still really enjoy what I do. And there's a number of reasons why this is the case. I really enjoy the relationship that I have with my patients. I spend time talking to all of my patients, and it's a very detailed, important conversation at a very critical moment of their care, which is really meaningful to both them and me. I love working with colleagues in theatre. Theatres is a strange environment at first, but actually when you get used to it, it's a really lovely team working environment, and it's extremely enjoyable. So I also enjoy working with trainees, and we have a lot of experience in anaesthesia of working very closely with trainees and directly supervising trainees as well, which I find incredibly enjoyable. And in fact, there's nothing more rewarding than seeing people starting as novice anaesthetists, working their way up through the training program, and then coming into consultant posts. And several of my consultant colleagues in Brighton came through the training program over the time when I was college tutor and head of school, which is wonderful. It's really a lovely thing to have been part of. I enjoy the challenges, the clinical challenges, the problem solving that goes hand in hand with my career. I still encounter really significant challenges in terms of clinical problems, not often, but from time to time. And I think although it's something that is obviously can be quite stressful at the time, I think it's really good over the course of a long career over many decades that we do continue to challenge ourselves and do continue to try and sort of push the envelope of your capabilities as part of your career development. Obviously, there are new developments in many areas in medical practice. The way that anaesthetic practice works has changed enormously over the last 9 months or so during the COVID pandemic. Lots and lots of new developments, lots of new equipment that we're using, and that will continue to evolve very quickly, I'm sure, over the coming years. And then anaesthesia in particular has many opportunities to diversify in terms of a consultant career, and also during the training program as well to take on other responsibilities. It's also a really good career for those who wish to work less than full time, because it's very much a sessional job, and it's quite easy to fit in fewer sessions around working less than full time. So the bad decisions that I've made, and I've identified a few bad decisions that I've made, I don't think they had too much of a negative impact on my career, but I think with hindsight, with the benefit of hindsight, there are definitely things that I would have done differently, which would have improved my experience over the last couple of decades. So the first thing, which really did blight my summer holidays back in the early 90s, was really just not working hard enough, in particular for my first and second MB exams. And I failed one subject in both years, which was incredibly frustrating, very stressful, because obviously you run the risk of being kicked out of medical school if you fail your first and second MB exams. I think what I learned from that was that I really needed to step up and work in a much more focused way for exams. And I'm happy to say that since that experience, I've passed all my exams subsequently, which I suppose at least I was able to learn from the mistakes that I made, I suppose, in those early years. The second thing is that although I did work briefly overseas as an undergraduate as part of my elective, I've never taken up the opportunity to work overseas or go out a program during my training as a postgraduate. And I think I really did miss out on a lot of additional experience, and probably a very enjoyable experience as well. Probably most trainees that I have worked with as a consultant have done some sort of out of program activity, and many of them have worked in places like Australia, North America, and they've had a really enjoyable and interesting time in doing that. So I would urge everybody to consider that. Obviously, at the moment, that's not something that's really practical right at this point in time, but certainly when you're thinking about your longer term career, I think there are huge benefits of gaining experience working overseas, and I would certainly do it again if I had the opportunity. And then academic qualifications, I never took a BSc when I was at university, at least in part that was due to the fact I didn't pass my exams in the first and second year, although I did have an opportunity to do a BSc later on down the line. And I didn't do any academic qualifications during my training either. And I think that the world has changed over the subsequent couple of decades since I was training, and actually that there are a lot more opportunities for people to look at undertaking qualifications in things like teaching and education, management, and other areas of clinical and professional practice, which really do give you a lot of additional insight into the way that the NHS works. And I'm very happy to say they also score you lots and lots of points when it comes to shortlisting for consultant posts if you're going to remain in secondary care, certainly. So that's something that I would strongly recommend that people consider as well. So who should you go to seek advice? Well, there's lots and lots of information out there on the internet. So I would certainly be looking at HEE's recruitment pages, going to your own college website, and then there's also informal information as well. There are things like Doctors Net, and there are WhatsApp groups and other informal chat rooms that doctors in training are able to access, and you can pick up a lot of really useful sort of the real deal kind of advice from looking at those more informal ways as well. I would also strongly suggest that you talk to the people that you work with or the people that work in your trust. So that would be including trainees in the specialty you're thinking about applying to, the college tutor or specialty tutor, and also educational supervisors. And people are always very happy to speak about why they've done what they've done and what they enjoy about it. So I think this is a really useful avenue that people can take. And certainly go and talk to the people in the specialty that you're interested in. They will be delighted and flattered that you're interested in a career in what they've chosen to do. I know certainly college tutors in anaesthesia are always really very happy to talk to people showing any sort of interest. What you might want to consider as well, so duration of training varies. Training in general practice takes 3 or 4 years. Specialty training takes longer, and in fact many people take longer than the 5 to 8 years of the programme as well if they're going to go out of programme. Some specialties have run-through training, so you are recruited in ST1 and go straight through a programme to the end when you will come out a consultant. Other specialties, so medicine, surgery, anaesthesia, to name 3, are uncoupled and have separate core and higher training programs. So you might want to think about whether that has any impact on your decisions. I think something that's really important is to think about the roles that trainees undertake, that junior doctors undertake in specialties, against the roles that consultants would be looking to undertake. And often they are not the same. So in fact, doing something that because you like what the trainees are doing may not be reflected by you continuing to be able to do that as a consultant, and roles can have quite important differences in terms of responsibility, in terms of the professional elements of those roles, and indeed the clinical elements of those roles as well. So think about that very carefully. And if you're looking in secondary care, you should be looking very carefully about at what the consultants are doing in a particular specialty. Geography is really important. There are obviously parts of the country that are much more competitive and parts that are less competitive. KSS, I think it's fair to say, is not particularly competitive for many specialties. So you're already in a good part of the world to apply Obviously, people looking at going into London, there's far more competition in London simply because there are more people coming through medical school and foundation programs in London. And then think about postgraduate exams. These are very challenging indeed and are an important part of the training program for all specialties, really. So think about how you might be able to approach those exams and whether they're the right thing for you to be considering. Less than full-time working, I've also already said, is something that lends itself to some specialties perhaps more than others, but it is possible in pretty much everything that you can do in medicine. And increasingly, this is something that people are looking to undertake to reflect that their sort of wider lives, really. So I wouldn't be put off doing anything approaching from a less than full-time perspective, but it is important just to consider how straightforward that might be. And then academic opportunities. So some specialties have a much more embedded academic basis than others. If you're interested in doing potentially a high degree or even a PhD, MD, then there are things that will be easier to access through some specialties than others. And then the future workforce is really important. So we are training doctors now who will really be in the sort of senior leadership roles going into the second half of the 21st century. And the population demographics are going to change really significantly. There's going to be an aging workforce, aging population, sorry, I should say, with far more frailty, far more complex morbidities, comorbidities seen in the population. And I think that the NHS workforce will need to reflect this. And there may be things that become more important and there may be things that become less important over the coming decades. So do have a think about what the country might look like in 10, 20 years' time. Now, this is a really interesting slide, and I've given you a web link to the competition ratios as well, and I know that this is something that people are very interested in. This gives you an idea of the competition ratios for different specialties, and these are all at core training level when you're looking to choose what you're going into. And you can see they vary from pediatrics 1.18, general practice 1.34, quite low. Internal medicine is quite low as well, up to the much more competitive specialties, in particular radiology, ophthalmology at well over 3 to 1. Now, although this gives you an idea of the likely competition that you're going to face, do remember that many people, probably most people, will be applying for multiple programs. So actually, when you look at the number of doctors and the number of posts, it's much, much more closely aligned. And the reason you're seeing these higher numbers in terms of competition ratio is because people are being double, triple, even quadruple counted by virtue of the fact that they're applying for lots of different specialties at core training level. So I think it's important to bear that in mind. I wouldn't advise anybody to embark on a career simply because it's easy to get in at the bottom. I don't think that's particularly a good basis for making your mind up on something that will affect you over many years to come, but certainly it gives an idea of the likely challenges around recruitment. If you do want to apply for something that's a bit more competitive, you're going to need to make sure that you've got a good CV, that you've done plenty of other things as part of your foundation training or other training in medicine in order to be shortlisted, in order to get points at interview. So the recruitment processes. So this is something that's changed enormously this year due to the COVID pandemic. Obviously, we previously had face-to-face interviews for most specialties. That's not something that we can do at the moment. However, the way that recruitment has changed is extremely variable across the different colleges. So really the way through this is to go and look at the specialties that you're interested in, look at the website. There will be information about the individual recruitment processes that those colleges are going to embark on for their recruitment programs next year. Just going to talk about the MSRA. This is the multi-specialty recruitment assessment that it's been used by some specialties, notably general practice, for a number of years now, but it's going to be used far more widely in 2021. So there are two parts to this test. There's a part with professional dilemmas, a number of professional dilemmas in an MCQ format, and then clinical problem solving as well as the second part of it. As I say, its use is much more widespread, but what it's actually used for is far more variable. So one or two specialties are using it as the entire part of the recruitment process. Others will be using it for shortlisting. Others will be having a hybrid of those two models where the scores will carry over. It's pretty much based entirely around the foundation program curriculum. So it should be something that everybody should be prepared to take. It doesn't require any specialty specific knowledge, certainly. So for anaesthesia, for instance, obviously there are very few foundation posts in anaesthesia. There's nothing specific to anaesthetic practice. It's more about your core knowledge of medicine in particular, and professional decision making around ethics and communication and things like that as well. The test itself is conducted remotely at test centres. It's free to sit. And there's an awful lot of information available online which gives you a better idea about the MSRA, and I would very much recommend that everybody goes away and has a look at what the MSRA involves. Really important. So interviews, there are far fewer interviews actually than there were historically anyway, and that's going to be even more so over the next 12 months, I suspect. It's really obvious who's practiced and who hasn't. I've been involved in a large number of interviews over the years, and it's extremely clear that those who have taken time and effort to practice perform much better in interviews. So if you are going into a specialty or applying for a specialty that will want to interview you, I would really recommend that you try and get some practice, and that includes interview over a video conference format as well, because that's what we're going to be doing essentially this year. Interviews, what you have to demonstrate in interviews will differ from specialty to specialty, but I think it's a combination of things. It's a combination of you demonstrating that you're a good doctor, that you know about the constituent parts of good medical practice, and that you're a good clinician, that you match the professional specialty identity of the specialty that you're going into, that you align to those particular values of the specialty that you're looking to apply to. But also you need to think about what makes you different and what sets you apart from all the other candidates. If you just give examples that will be applicable to everybody applying for the job, then it's impossible to separate you as being a different person, as being a better person than the other people involved in the interview. So think also about what makes you different, what makes you special, what makes you better than the other people that you may be competing against. So to summarize, I think there's a lot of value to be gained from talking to people about what careers you might be interested in. You need to gather as much information as you possibly can and look at the longer term picture as well. Think very carefully about the scoring criteria for the particular recruitment processes that you are that you're going into, and try and get some interview practice as well. So I'm going to leave it there, and just to say very best of luck to everybody. If anyone would like to contact me, you are very welcome to do so, and the medical education department will be able to supply you with contact details for me. Thank you very much indeed. Goodbye.
Lovely. That's perfect.
Okay, was that all right?
Yes, that's brilliant.
Great. Yeah. All right. Well, look, thank you very much indeed.
Thank you very much. You've covered quite a lot, actually. You know, it's almost like you've covered our handbook. Yes.
Oh, really? Okay.
Yes, you have. Yeah.
Hang on, let me just come back onto. There we are. That's it.
Yeah.
Great. So, and this is running next week, isn't it?
Yes, it is, and it's on Monday, and you are one of our keynote speakers, so you'll be on the first page of the program.
Okay.
And well, I'll give you a link of where it is as soon as we establish the web page. But yeah, we're in the process of knitting everything together now. So and launch it on Monday.
Okay. Oh, that's brilliant. Well, look, very best of luck with everything. I
Yes.
hope it all goes well. It's been such a positive thing in the past. I've really enjoyed coming to them over the last couple of years. So I hope it all goes well. And as I said, if anyone does want to get in touch, I'm really happy for people to contact me via email.
Yes.
Yeah, they're welcome to do that.
That's very
Yeah,
kind of you. You want to be disturbed by all the trainees.
that's fine. That's fine. That's fine.
Yeah.
Yeah, yeah.
Thank
Well,
you. Thank you very much.
I hope it all goes well. If there's anything else I can do to help, then do let me know, obviously.
Lovely. Thanks, Chris.
All right. Thanks, Mina.
Thank
Bye.
you. Bye-bye.